When you feel it's your time to go, wouldn't you want it to be a safe procedure in a controlled environment rather than from your bedroom ceiling fan? Members of the Department of Health think tank are Miss Hennessy. Today I'm here to convince you that the laws in our country need to change. Euthanasia, or voluntary assisted dying, is a medical procedure of administering a lethal injection, usually for people in the last stages of a terminal illness. However, in a few countries, it can be administered for psychiatric suffering, such as depression and post-traumatic stress disorder. This presentation will highlight key points that are pushing for the legalization of euthanasia nationwide. People have the right to die. Now, this might sound strange at first, but if you think about it, shouldn't we all possess the right to stop living if we wanted to? I mean, people can end their life now if they want to, but there is no support from the laws of Australia allowing someone to do this in a comfortable setting under the administration and control of a trained professional. The self-determination of one's death is a major stance that people who are pro-euthanasia push. It is the belief of many that societal control by the government and its laws go too far when they directly impact the needs of someone who is unendurably suffering. Self-determination on a matter means that the circumstances under which an action will take place is decided by oneself. So in this instance, people will be able to choose how, when, and where they die. Does this not seem fair to you? As well as the self-determined aspect, it would have to be controlled by a professional, whether or not it should be done. The process would be regulated due to the reason behind the euthanasia, the state of the person involved, and if it is deemed necessary for the process to occur. In most places where euthanasia is already legal, such as Oregon, it can only be done if the person is over 18, makes 2 verbal and 1 written requests. They must be terminally ill and expected to die in the next 6 months. The patient has to administer the lethal medication to itself, along with a few other points which I've put on the board. In the Netherlands, however, a patient can be euthanized if they are deemed to be enduring intolerable suffering, which includes mental illness such as severe depression. Patients aged 16 and up can make their own decision on the process, but children as young as 12 can be euthanized with the approval of a parent or guardian. Once again, the full list of requirements is up on the board. I believe that if euthanasia were to be legalized in Australia nationwide, it would have to be regulated similarly to Oregon. Even though these restrictions mainly affect the elderly, the implementation to our country would greatly affect the high rate of suicide. In recent years, the rates of suicide have increased dramatically, as shown on this graph. And statistically in Australia, males 85 and over have the highest suicide rates as per this other graph. This may seem hard to believe, but it's true. For many of these elderly men, they have been diagnosed with a terminal illness and are just forced to wait out their remaining days, wondering if they're going to live to tomorrow. This kind of pressure and worrying is not something that somebody would want the end of their life to consist with, so they choose to end it early. This process would be forgotten about if they had the option to euthanize should they feel it necessary, so they may pass away sure and content of their near future. The euthanasia of a suffering elderly person would greatly benefit the family and friends involved, as they would know that their loved one is finally at peace. This would also free up space in aged care facilities, as well as reducing the total government costs spent providing pensioners with benefits and payment. Different media outlets such as the ABC and 9 News have written articles on the subject, and both display pro-euthanasia societal attitudes, values, and beliefs. This is a big step forward if such influential news outlets are pushing for this. In conclusion, euthanasia is a safe and controlled procedure that should be legalized in our entire country. It would allow people the right to die pain-free when they want, which is something I believe is essential. While it may seem like a non-standard procedure, it could be regulated and carefully watched so as to ensure that all restrictions set in place are met. It would greatly improve the mentally well-being of elderly terminal patients when it comes to the certainty of the near future. Miss Hennessy and members of the think tank, your time has been valuable. However, if this law is to be abolished, we need to band together and fight against it. At the end of this digital presentation, there will be a petition linked calling for a change in Australia's euthanasia policy, and I urge you to join me in making a difference. Thank you.